Hi everyone, I am Nicole Young. I am your Mass A1 section chairperson. I would like to welcome everyone to this evening's program and thank you for your commitment as we work together to save everyone's life. This program is being brought to you today by Mass A1, Mass Department of Public Health, the Betsy Lehman Center, and the Institute of Perinatal Quality Improvement. As an A1 member, you are able to attend this event and one of the Speak Up programs free of charge. This is just one of the benefits of being a member of AWHONN. Some of the other benefits are continuing education, instant access to the latest resources in journals, member rewards, and more. Your Mass A1 coordinating team meets the second Monday of every month via Zoom. What a great way for you to get involved with helping women's lives in nursing excellence here in Massachusetts. Let us know if you'd like to join and help. This Speak Up program has been created by the Institute of Perinatal Quality Improvement. We're going to change slide. Thank you very much. None of the speakers here have reported that they have any conflict of interest or disclosures. Meeting is being recorded, so we'll be able to use it again in the future for more teaching. At any time you need to put general comments or questions, put them right in the chat, and we have coordinating team members sitting by to answer those for you or get you the best answer. If you have a private question that you might need some assistance with the technicalness of today, please don't hesitate to put a private question in chat to Natalia or Megan from the Betsy Lehman Center. Please put your name and organization in your chat, and everyone is muted during our presentation. There will be Q&A session at the end of the presentations, and you'll be able to unmute yourself then to participate. This evening's program, we're going to share some disturbing statistics and introduce to you the work of Speak Up. The program is scheduled 4 times during 2021, so we have lots of opportunity to participate. We expect that our limited space will fill up quickly. Each program is 2 4-hour sessions, the first one being January 20th and 27th. You'll then have opportunities in March 23rd, 25th, May 18th and 25th, and then finally in September 22 and 29. Again, thanks to an amazing grant from the Mass Department of Public Health that was secured for us by Dr. Hatsu Jope, we are able to offer these to you free of charge. I am going to introduce to you now our speakers so that we can just move through the program. The first speaker that you're going to hear from today is Fifi, and then she is the director of the Office Data Translation at Mass Department of Public Health and the PI for Perinatal Neonatal Quality Improvement Network, also known to many of you as PINQUIN. Dr. Deborah Bingham is the associate professor at the University of Maryland School of Nursing. Dr. Bingham is the founder and executive director of the Institute of Perinatal Quality Improvement. Bunal Glass is a clinical faculty at UMass Dartmouth College of Nursing and Health Sciences and was a founding member of Mass Perinatal Quality Collaborative. Kate McGovern is a professional development director in perinatal services at Tufts Medical Center and a member of the AWHONN coordinating team. So are Deb and Bonnie, sorry about that. Also, we have Yamli Kayamit. She's a registered nurse and lactation consultant at Brigham Women's Hospital in their postpartum and NICU units. She's the co-chair of the Unit Practice and Policy Council and legislative coordinator for Mass A1. We also are going to hear from Mimi Pomelo. She's a professional development manager at Brigham Women's Hospital. She's also a past president of AWHONN 2013. Karen Maganaro is a clinical educator for the Center of Women and Newborns at Brigham Women's Hospital. She's a member of the Mass A1 coordinating team and serves as an A1 state nurse leader for AIM, the Alliance for Innovation on Maternal Health. And Colette DeJuice is an assistant Colette DeJuice is an assistant professor at Simmons University School of Nursing. Ms. DeJuice earned her PhD in nursing from the University of Massachusetts Medical School and has taught across the undergraduate curriculum in a number of courses at Simmons colleges. Thank you all for what you have put together and prepared to share with us. I look forward to hearing from each of you.
My name is Deborah Bingham. I'm, as was stated earlier, I am the executive director and founder of the Institute for Perinatal Quality Improvement and one of the creators of the Speak Up program. And this is the Speak Up program is a quality improvement approach to eliminating disparities, racial and ethnic perinatal disparities. And it is with great honor that we are partnering with the AWHONN Massachusetts and the Department of Health and the Perinatal Neonatal PinQuin Improvement Network for the state of Massachusetts. This program is hard work. Dismantling racism is not work that is one and done. You know, one educational program isn't going to all of a sudden eliminate all of the structural racism, all of the cultural racism that is embedded and baked in our own lives. So, but we are really pleased to really have such an opportunity to have so many, all of the AWHONN members will have an opportunity at least, and to go through this training to have a very strong foundation to build from. And so we're very excited to be partnering, and in 2021, there will be four opportunities, as was announced by Nicole, for you to be able to register to attend one of these Speak Up trainings. Of all the forms of inequity, injustice in healthcare is the most shocking and inhumane. And I just want to preface what I'm going to say, and also just, it's hard to hear the statistics that Fifi just outlined from the Department of Health. It's hard to, as a nurse, and especially many of you, all of you work in Massachusetts, to think all of the work we're doing, and there's still so much more to be done. And that's very hard to hear. And so, you know, but I hope that you will approach this conversation with the willingness and openness to opening your hearts and your minds to really be able to think about, is there something more I can do? And are there things that I personally am not aware of, but with more openness and more insights, there may be ways in which I can make a difference that I had not thought of before. So tonight we're going to be introducing the Speak Up program to you all, and we're going to describe why Speak Up program was developed, outline some Speak Up strategies, and I'm so excited to have the panelists helping with those. We're going to go through each of the elements of the Speak Up acronym, which is also a mnemonic. And then we're going to talk about how you can pledge to become a Speak Up champion, and then give you a little bit more information around how to register for the January training. There is still room in that training session available. So this is what Speak Up is. Again, it's an acronym as well as a mnemonic. And it, you know, it's, so I'm going to just, so you can see that the first is set limits, practice and prepare, express your concerns, apologize, keep improving, uncover and learn, and persuade others. And we do also have this poster with all of the logos on that is available for all of you to be able to have some posters as well. So I know Matthew Medina, who's on the organizing committee and also is the section secretary for AWHONN, has some that he can help distribute it out to all of you as well. Anyone who registers for the training will get a packet which will include a poster as well. And the poster, this is what the poster looks like. So PQI was formed, the Institute for Perinatal Quality Improvement, or PQI is our nickname, is to expand the use of improvement science to eliminate preventable perinatal morbidity and mortality and perinatal racial and ethnic disparities. I, for one, have done a lot of work over many years. I helped start the California Maternal Quality Care Collaborative. I was a vice president for AWHONN. And a lot of the work I did helped reduce maternal deaths and injuries but the disparities still remained. And so that's why one of the reasons why this program was created is because it's not acceptable to have these disparities continue. They can be eliminated. In addition, 2/3 of pregnancy-related deaths are also have been identified consistently to have been, there could be a strong chance to prevent those deaths. So, so that's what we're working towards. Fifi gave you the state data. Nationally, the United States is also just trending in the wrong direction. Our rates are just too high, especially when we compare ourselves to other countries. And I liked the Fifi's histogram that she showed. And this is showing what this shows, and this came out of the USA Today article that was a couple of years ago, showed us that our rates in the United States have gone up, other countries have gone down. So we really have to do some soul searching, very deep soul searching, and looking at everything, and what are we doing, and what's changed in just these short periods of time, that what's causing this rise in maternal deaths. And so one of the things that, as a QI perspective, as you go in and you do your root cause and you really try to understand your data, one of the things that we see right up front, and that's and in Massachusetts, in pregnancy-related deaths, there was this huge disparity, and in the United States there is as well. So it's about 3 times as many deaths. And then in Massachusetts, nationally, we have seen a rise in severe maternal morbidity, almost a 200% increase in severe maternal morbidity. And in Massachusetts, you saw that by race ethnicity, Black women had a 70% chance of higher chance of having severe maternal morbidity. And if you're like me, like that's really not, you're not comfortable with that. And that's why you're here tonight. That's why you're giving up your time to be here, to figure out, what can I do more? So this article was really, this headline, as well as the article, was really upsetting to me when this came out a couple of years ago. Nina Martin and Renee Montaigne, who did interview me, and I did, and the work I did in California has been touted now because as being a great example. We were able to reduce maternal mortality by around 55% in about 5 years, by all of us acting together, by all of us looking and doing everything we could differently. And I think the same can be true in the state of Massachusetts. So when this article came out and said nothing protects Black women from dying in pregnancy and childbirth, I'm like, wait a minute, I've done all this work, but and I've helped make a difference, and a lot of other people feel the same way. Obviously, it wasn't just my efforts; it was everybody working together. But it was because of Shalon Irving's death that this headline was why they published this particular article. And Shalon Irving's death kind of defied all the odds. Her educational level, she had a PhD. Her income, she had a job, she had insurance. She actually worked at the CDC. And she still died after having given birth. She died the same day that she saw a clinician who didn't take her symptoms very seriously and sent her back home. There have been other deaths, Erica Garner, Kira Johnson, and others, too many to name. And then we have even celebrities with near misses. And in this article, one of the things that hit me, and I know it's deeper than this, but this is a huge piece for all of us to consider, is they said that over 200 Black women described being disrespected, not being heard, not being treated with respect. And I'm like, we can do better than that. Like, that's not, if somebody could come and say that they felt disrespected, that's That's really needs to be addressed. And as a healthcare professional, I thought back and I could think of ways in which I had heard people's concerns and had been dismissed. I was a director of nursing in New York City, and I remember jokes being told about people, or people rolling their eyes when someone came in multiple times, calling them frequent flyers, things that are very disrespectful, how people answered the phone. There were a lot of things as I read that article, I was like, oh, wow. And I haven't said anything. I kind of let that pass. I didn't want to be I didn't always speak up for somebody who was being disrespected. And I thought, if you're being disrespected, then you may not even come back, or you might wait too late. You may not tell people what's really going on. It's huge. And it's something each one of us can change about how we treat other people. This is the image of Dr. Irving. Again, she breaks the myths, like the myths that are in people's heads, like in all of our minds. We've been taught that race is the risk factor when actually it's not. Being Black is not the risk factor. Having dark skin is not the risk factor. It's racism, and being willing to start to see that and start to recognize that it's not that any one of us wants to do anything that's racist. But it's that a lot of it's very unconscious. And I'm going to let you hear Latasha Roos. I met her at a National Quality Forum meeting. She was one of the, she had a near-death experience, and she describes exactly what I'm talking about as this, and she called it these small moments of decisions is how patients sometimes get lost. And it can be bigger than this, but at a minimum, like, I want you to start to think about, paying attention to even the smallest details and how we can change all of this. So I think Megan's going to play this video for us.
Deborah, if you could stop your screen sharing so she can take over for a moment. Perfect.
There we go.
Instance, their level of concern never raised, even after I fell. They got me out of there, but once we get to the ambulance and I get my IV and the lights come back on, and I feel like everything has brightened up, and I didn't even know it was dim. I heard them discuss what they were going to do next and the rest of their day, and Starbucks, and on and on and on. And in that moment, and over time as I unpacked it, I started to realize that they were not able to see me and what was actually happening with me because of how I presented at the time. And in that instance, those small moments of decisions is sometimes how patients get lost in how things happen when people are not intending for it to happen at all.
Thanks, Megan. So I think, you know, as she was telling me her story, I thought, wow, you know, it's those small moments of decision. What a powerful story. And if you read the text in that video, her larger story was at that time she was living in what she said, a place where a lot of Black people lived, and she was sure EMS had been called there many times. And she said they just kind of grouped her in, like kind of just categorized her. And as she said, they never even asked her how much blood she had lost. They told her, she said, they're like, well, we need to get you in the ambulance. And she says, I don't think I can walk. And they said, oh, sure you can. And she collapsed. But they asked her several times whether what drugs she had taken. You know, and those are really serious minutes that are being lost. And she goes on to describe when she went to the hospital, how she also wasn't taken that seriously and was left kind of not really urgently attended to. So her story is very powerful. And then also just how disrespectful that is, and also what message does that send by then in the ambulance, they're just like talking about their Starbucks order and what they're going to have for, you know. And honestly, I've been there, you know. You're trying to get through your shift and through your day. Like I could actually remember sometimes I had done that, had acted in ways that was really not as respectful as I wish I was always had been. So I hope, you know, that's just a small example of how being more aware, and the CDC does have a big campaign right now. It's called Hear Her, and it's really emphasizing this point of believing patients and hearing what people say. Monica McLemore has published this study around perinatal care, prenatal care, and feelings of disrespect, and then how stressful that is to people. It's the healthcare encounters that include racism and discrimination, stressful interactions with staff at all levels rather than having people being really welcomed, unmet information needs where you don't provide as much information. It's you're like, well, you know, she can't really understand that, but that's not appropriate. You know, we need to give everyone the same amount of information at the level that they can understand. Inconsistent social support, discrimination, racism, and disrespect in healthcare encounters is to believe affect the health and that of their infants. So just really thinking and embracing that. In the Speak Up training, we go into we go over a lot of myths, and we have heavy topics, and it's intense work, it's deep work, but it's also we try to help each other not be afraid to look at our data, and also not to let guilt overcome us, and really get motivated for action. The Speak Up program is based on QI, so a big part of that is creating an action plan and having people that help you, support you to think about how to do our work differently and make improvements. So we also really focus on, you know, moving away from blaming the individual or blaming people, blaming mothers. I need to change some of these slides to be more inclusive language. So anyway, but the idea being that, you know, it's too easy to just say, well, if they took better care of themselves, right, then there wouldn't be these disparities. But there's a lot of data to say it's much more complicated than that. And we own a piece of that. So as we think about racism and how that is baked into our structures and the power differentials that we're all very, you're a healthcare worker, you have a lot of power over people. I've been in, had family members and myself, and you don't feel very powerful in a healthcare setting. And so just thinking, but in our country as well, is racism involves one group having the power to carry out systematic discrimination through institutional policies and practices. And these shape the cultural beliefs and values that support these racist policies and procedures. And actually, one of the things that's kind of baked into all of us is we're uncomfortable talking about race, ethnicity, and really having a safe space to try to unpack some of our myths and some of our misperceptions, and even like struggling with like how to really come together and talk to each other. So I get it wrong a lot of times. I don't feel like I have completely figured all of this out as a white woman, and it's a bit uncomfortable for me. And I'm like, and I've been doing this a lot longer, so we do we work hard to have it be a safe space for you to be able to talk about some of the things that you maybe have questions that you have around race, ethnicity. And also, if we don't learn how to share with each other and ask each other questions, then we're not ever going to progress beyond where we're at right now. So racism's impact unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and undermines, and this is the important part, it undermines all of us. It undermines our ability to, as a state, as a community, to realize our full potential, because we waste the human resources of each other. We don't fully benefit from each other's. So I'm Dr. Camara Jones, who's been a leader for many years, helping explain about racism and its effect on individuals. This is a very powerful quote from her. It says, "Racism undermines realization of the full potential of our whole society because of the waste of human resources. Because we do not value the potential, and I would say value enough, the potential contributions of the children living in our ghettos, barrios, or reservations. Because we feel that we can get along very well, thank you, without them, we do not invest in developing their genius, and it is lost." And then that's lost to all of us. So as Ibram Kendi, who actually just joined the faculty at Boston University a few months ago, he's written several books that have been very powerful and important to my journey of understanding around my own biases, my own racism, has really promoted the idea that anti-race, like it's not enough to just say I'm not racist, but actually we need to actively work to be anti-racist. And so, because otherwise the default is a racist society. So, so as individuals, if we want to be, so that's like we need to be actively working to eliminate racism because it's so baked in. So now we're going to go over some strategies, and this is where I'm going to call on other members of the panel to be able to help us go through the Speak Up acronym, and they're going to talk from their own personal experiences, because I thought that would be really helpful for all of us to hear some of their ideas. And just keep in mind, I know, people are like, well, that seems, really what difference does speaking up have? How could that actually change anything? But just keep in mind that conversation is where change begins, and each one of us has the power to speak up and to change the conversation. So now I'm going to turn it over to Bonnie.
Thank you very much, Deborah, for that powerful introduction. to this issue. I am going to give an example of the S for set limits is in the Speak Up acronym, which is to allow only racially respectful speech and actions in your workspace. And I would add to that your personal life, because the example I'm going to use was personal. And I so much appreciated the opportunity to think about this, because it was a story I had actually pretty much forgotten. And it's a personal story. In 1973, I lived in Jackson, Mississippi with my spouse and my 2 children. And I hired a young Black woman to watch my children and do some light housekeeping 2 days a week while I was taking courses to prepare to go to graduate school there at the university hospital. And she rode a bus from downtown Jackson to where she lived, to my house in a suburban neighborhood in North Jackson. And there were many Black women who worked as domestic help who rode that bus. In fact, nobody else rode that bus. Just that bus existed to bring women to work in households and where they were employed. And the woman that worked for me was young, and her name was Beatrice. And I offered her the federal minimum wage hourly rate at that time, and she accepted, and I paid her in cash each week. She was reliable. She did a wonderful job. My children loved her. A few weeks after she began working for me, I received a written petition and complaint from my neighbors that I was paying her considerably more than the usual rate of pay, and that many Black women who worked, and that it was creating discord among the other domestic workers in the neighborhood, and they demanded that I decrease her salary. Thought about it a bit, and then walked across the street to the home of my neighbor who had delivered the petition, informed her politely that I was not going to decrease Beatrice's hourly wage because it was at the federal minimum and it's what she deserved. A week later, a cross was planted in my front yard, and I don't know whether you know what that means, but a cross planted in your front yard is a threat from the Ku Klux Klan of some kind of harm coming to you or a member of your family. I kept my children close by, ignored the cross. Eventually, I took it down, and was never included in any neighborhood social events after that, but it was no great loss. The framework, the slide that, let me see, there it is during those same years that I lived there, I had the privilege of meeting and knowing Eudora Welty, the Pulitzer Prize winning author who lived in Jackson, Mississippi, very quiet, lovely little woman. And she was a friend and a neighbor of an older woman from my church who had befriended me. And in 1971, she published a volume of photographs that she had taken throughout Mississippi. And this is her quote in why she took these, and she published them in a book called One Time, One Place. Very, very, very powerful photographs that she took with her Brownie camera as she traveled all across Mississippi, capturing these powerful images of Black women, men, children in their daily lives. And the pictures celebrated their humanity and their resilience. And this image is of a Black woman toiling in a field in the Delta. And Eudora Welty's words were, "In taking all of these pictures, I was attended, I know, by an angel, a presence of trust. I wish no more to indict anybody, to prove or disprove anything by my pictures than I would have wished to do harm to the people in them, or have expected any harm from them to come to me." And I don't think that needs any explanation or interpretation. That is a powerful message. So through that, I learned, and other experiences that I had there, that each woman deserves an opportunity. And I had an opportunity to practice perinatal nursing in that community and in that university hospital, and make home visits to mothers and their newborns in the Mississippi Delta. And it was a marvelous opportunity to participate and contribute. And the next is, I'm handing off to Kate McGovern, who is going to describe practice and prepare.
Great, thank you, everyone for coming. It's my privilege and honor to be able to talk to you about the practice and prepare step in the Speak Up program. One of the most life-changing events I've ever had was to attend this program about a year and a half ago, and it was just amazing. And so when I had the opportunity through AWHONN to work with Deborah again, it's been a true honor. So for practice and prepare, it's to plan how you will act if you see or hear someone being treated or referred to disrespectfully. It's not easy to do, right? As to speak up when you see something out of fear or regret or whatever. As an educator, I believe in self-assessment. So to start with, you're going to do an assessment of your clinical cultural competence. This has been influenced by your beliefs and your values. So think of times when patients did not follow your advice, or review. Is it likely that you offended them or they didn't establish trust? I mean, when you look at how you care for patients, think about those that relationships didn't go well. And oftentimes the nurse will say to me, "Can you believe the patient fired me? I'm such a good nurse." And people want to do right and they want to care for people, but sometimes we do things that we don't even realize are offensive. The second thing I would bring up in practice and prepare would be to remember that it takes work to become anti-racist. It is work. It's going to be some of the hardest work you're going to do. For example, many of you might be thinking, I will ask my Black friend, insert any name here, what can I do to help promote change? It is not the job of the person who has suffered injustice or trauma to teach you. You may be inadvertently adding to this person's burden. So thinking about how can we improve and how can we make things better, it really does take an intensive program similar to the Speak Up program to help you first process a lot of this stuff for yourself. And then you can go on to help others, right? For example, it's like the putting the mask on yourself before you help your child, right? Those types of things. But this is really hard work, and it's going to take some time and a lot of reflection. For preparation, you can't avoid asking the hard questions, and you have to educate yourself. Discover your biases, what gaps you have, and this is what the Speak Up program helped me to do and has helped many others to do as well. During the journey, you might discover ways in which you unknowingly benefit from racism. And that is something that's going to take a long time to review. The third is overcoming guilt. As you go through this process, it may trigger some things from your past that you reflect on and realize that you may have caused harm to others, not realizing it. But one major question you want to keep in the forefront is, does this guilt lead to change, or does it simply lead to thinking about how this affects white people, right? So sometimes we turn it back as from a self-reflection and consider ourselves the victim. So making sure that you can keep in the forefront the injustice that is ingrained in our racist society is not all about you. It's about society and where we can make improvement. Using quality science tools like the PDSA cycles, the fishbone diagrams that you have access to in the Speak Up program, as well as the respect process, you will make discoveries, and most important, you will make change. And now I'm going to hand it over, I think, to Yamali.
Hi, Kate. Thank you so much. And I'd just like to thank everyone for coming and listening to us tonight and joining us. So I'm going to be discussing E, express your concerns, be bold, clear, and straightforward. Discuss why you are concerned. So my example is one from before my time with the Speak Up program, when I was not as bold or straightforward, but more quiet and kept my concern to myself. I keep this example in my mind, and it reminds me to always speak up and express myself in order to educate others so that the bias won't be continuously made. While working on a predominantly white floor, I was asked about my background, typical introductions, asked about where I was raised and where I went to school. After telling a nurse about myself, I noticed that she was silent and seemingly just wondering about me. After a pause, she was like, "Oh, okay, so you're a Metco kid." And to her surprise, I was just calm and quiet. I simply said, "No, that's where I was raised and that's where that's where I've been living." Uh, for those who don't know, Massachusetts has a program for K through 12 students that brings those who live in Boston to greater Boston suburbs for school. By assuming I was a Metco student, this nurse failed to recognize what she was doing. Unfortunately, I was too shocked to speak up and ask this nurse why she made her assumption and educate her. But now I am more aware and I have the strength, and I always strive to speak up and express myself, not only for myself, but for my patients, no matter what the situation may be. And I always like to think that if a bold, biased statement can be made to a colleague and a fellow nurse, it can and most certainly has been made to a patient. So while speaking up for Black women and expressing yourself, it's important to remember to be an advocate. Definitely just be your patient's best advocate. History, research, and way too many patient voices and cases have told us that Black women are not being heard. Not only are Black women in the US 3 to 4 times more likely to have a pregnancy-related death than a white woman, but among all other racial and ethnic groups. Speaking up for Black women when you see both explicit and implicit bias may be difficult, and it definitely is. I agree, it is for myself as well. But in order to see change, some people need to be educated on their bias, and you just have to start the conversation. Great opportunities to speak up and express yourself include during an incident, such as my example, or after an incident by debriefing. Thank you. And now I will hand it off to Deb with Apologize.
Great. Thank you so much, Emily. Thank you for also all of you for being vulnerable and being willing to share personal stories. I think that it's helpful to me. For apologize, it's say you're sorry, change your behavior, and ensure reconciliation if you said or did something that perpetuates racism. And just keep in mind, have humility. If somebody says to you, like think about Yamali's statement, what she just described, if she was brave enough to say to you, actually, that isn't, no, I was raised in Concord and you're assuming that because of the color of my skin, that's, making some statement. That's not easy. You just heard her say how hard that was for her to say that. So if somebody is brave enough and says to you, what you just said is racist, then rather than get defensive, then say, oh my gosh, and stop and think and reflect and say, I'm so sorry. You're right. That came, I have biases I still haven't really fully unpacked or understood. So, but it needs to be a real apology. Sometimes people will say, and you've probably had people say this to you, is like, oh, I'm really sorry that offended you. Well, that's not an apology. It has to be heartfelt. And if you hear somebody say something bold and not willing to apologize, also be an ally. You can then reach out and say to the person who was offended, as well as to the person who wasn't hearing what they did was offensive, you can stand up to that person as well. So you can have allies to help explain. So my personal experience is recently I so I do these speak up trainings, right? So you think, oh wow, like I should I should know this inside and out, and I've been doing a lot of reading and been learning, but then we had a recent training we were doing, and I realized there were some things I was doing in that training that were coming from my own personal biases, and vice versa with my co-presenter. And then I did apologize to her as I thought, reflected back on what had happened. It's a very specific thing that happened within the training that I won't explain, but I did apologize to her and said, I really hadn't thought that through, and I'm not going to do that again. And she's so generous. She's like, yeah, no, thank you. I appreciate you bringing it up. And yeah, we're just trying to figure it out together. We're in this together. So, and that keeps, that meant a lot to me, how she responded, as well as I think it meant a lot to her that I would even be self-aware enough to realize that I had what I had done. So thank people when they point out to you that what you did is perpetuating racism. Try not to be defensive. The people who are willing to tell you are brave to say something. Don't shut down the conversation. You can say things like, oh, wow, explain to me why that, if you're not understanding, like truly try to have it explained to you so that you understand better. And so that's apologize, make it a true apology, reconcile, and change your behavior. Now I'm going to turn it over to Mimi.
Hi, so I have K, which is keep improving, be courageous, become aware of your implicit and explicit biases, seek feedback, and collect data. Now you can do the next slide if you'd like. Although this picture is beautiful. I see this is very similar to how the things that we do for new parents every single day. When we prepare parents to go home, often I will say to new parents to say, hey, you were raised in, especially first-time parents, you were raised in one family and you were raised in another. You could be from the same ethnicity, but every family is different, and you only know what you know. And so now you're learning to do this together, and you have to be kind to one another. Don't always correct, don't assume, just be nice to one another. And I think that that's what we need to do for each other. We need to be kind and understand what our personal biases are. In the case of Yamali, I would like to say that maybe Yamali didn't have to say anything. I think that this person, as soon as it came out of her mouth and got the answer, she probably could have apologized, lived with that discomfort and said, gee, I'm sorry. But it comes from her own bias. Maybe she grew up in a white suburb and the only Black students she ever knew were from the METCO program. So it's what she only knows. And it is a time for us to say, ooh, that is one of my biases, and I wasn't even aware of it. So many people, especially around here, whether you've done it before or you could do it again, I've actually done it a couple of times, but we put the link in here for the Harvard implicit bias, understanding where you are, how you feel about these things. And one of the things as we're talking about it right now is I want to throw out there to anybody in Mass A1 who wants to participate with this. I'm happy to help facilitate it. We could do a Mass A1 Zoom and pick actually, the first of the year to start for January in honor of Martin Luther King Day. We won't quite get there on that day because it's a 21-day challenge, but maybe do a weekly recap of the 7-day of the challenges. There is something that is out there that's called the 21-day challenge. And it is a collection of different readings, of different things that you can do to help you understand and uncover some of that biases that you have. And we could have a discussion. So if anybody wants to participate, put it in the chat, put your email, and we'll try to set something up. I'm hoping Nicole and Matt would help facilitate as well. and that we could have a 21-day challenge for all Mass A1 groups, and we can work with this. So my next person, I'm going to put on my mask and step away and let Karen talk about you.
Hello, everyone. The next letter of our acronym is U, Uncover and Learn. Be curious, mindful, and open to new perspectives as you deepen your understanding of racism and its harmful impact. So hopefully each of you has already experienced that aha moment where you've learned or realized something new this evening. Maybe you've seen many of these statistics that have been presented before, but felt certain they didn't apply to Massachusetts, and now you know better. Or maybe some of those small moments of decisions that we heard of in Latosha's story have resonated with you. Like most of the panelists here tonight, I've gone through the Speak Up training program and become a champion, and we're hoping that each of you will make the pledge and consider doing the same. So for me, when I went through the Speak Up training program, the most impactful discovery was the realization that the course I taught in a nursing program was incomplete. As I listened to the Speak Up faculty, it was a shock to recognize that my curriculum listed the statistics for increased rates of severe maternal morbidity and mortality and certain maternal conditions like hypertension for Black women and women of color without having the conversation about why those things might exist. There was no conversation about the potential for inadequate access to healthcare or inadequate access to healthy food choices. There was no conversation about increased environmental exposure and the potential for associated conditions like asthma, or any discussion about the long-term effects on an individual who experiences a relentless state of stress. I'm happy to say that the curriculum has been updated and those important conversations are now happening. I think this is what the Speak Up training program is all about, that hopefully each participant will take the information that they learn and expand upon it. There are many great resources of information to learn more, like your state's Perinatal Quality Collaborative, the Department of Public Health, or the CDC website. But sometimes the easiest place to uncover and learn is from our patients, by simply asking about their care and their experience in listening. And with that, I will hand off to Colette.
Thank you, Karen. So thank you everybody for coming. It's really good to try to get together and try to see what we can do about talking and also helping so that we can decrease maternal morbidity since the rate for Black women is so high in the United States. So one of the things that we talk about is to persuade others, and spread the word, encourage others to speak up against racism. We know that there is implicit or explicit bias is real, and that different time people have a hard time trying to figure out and trying to understand what it is that they need to do. And sometimes they may not even realize that they have biases, but we all have some biases and we need to figure out what those biases are. And then when we do, then we also need to be able to be a champion to help others to speak up when they see that something is wrong. It is, even though at time we can think that by speaking up, there could be some social threat. But I think it is our duty as nurses and part of the integrity of our, as nurse to make sure that we take care of our patient and we give them the best care that we can. And by doing that is to speak up when you see that there is something wrong. When somebody has said something, they may not have understood that is biased, something that may, they may not even realize that they have hurt someone by saying something too, or by not even seeing the real patient that is in front of you. So we need to try as much as possible to try to make sure that as nurses, we help our colleague to speak up when something is happening. When they see something that they need to speak up and try to help them to remediate the problem. So it is hard sometimes for us, but we should not turn away from difficult situation, from difficult conversation. We need to be able to persuade our colleague that and let them know what they said was biased, and then what they can do and help them to deal with that. We cannot be silent. We need to speak up. And so some of the things that I would suggest that you do is that whatever we do, we need to do it in a way, in a manner that you are not going to hurt the person that you are talking about. So I would suggest that you do it in private. Do not do it in front of other people. Pull the person to the side and let them know what you heard or what they said was not the correct way of saying that or not the correct things of doing. So we need to be able to speak to them honestly and then help them to learn that as nurses, we have all learned that we need to learn to listen. And then if they really go back and listen to what they have said, they may have seen the thread of the implicit or explicit bias that was in what they have said. So we need to be able to help to persuade them for them to be able to hear that. And then by hearing it, then we can change the conversation. We can change ways by doing that so slowly. So talk privately to the person, choose a good spot to speak to them about it, and then explain to them what you heard. And then if you can, narrate to them what would have been better to say. That way that you would give them an example for them to be able to move on. We need to be very conscious, about our own values and challenge and understand our own unconscious biases. And by doing that, we'll be able to help others. And then also by helping persuade others to talk about what is happening, to speak up against racism. What we're also doing is also advocating for the patients that is in our facilities. So speak up, persuade others, encourage people to, to speak up and not be afraid. Because by doing that, we will turn some of the problems that we are having and change the conversation and change and make sure that the racism that we see, we can decrease some of that. And overall, we can have better care for our patient because that's what we're here for. And now we're going to turn it back to Deb.
Thank you so much. Excellent points. And yeah, this is about this is about severe maternal morbidity and about dying. I mean, this is nurses, when we see something that's not right, we are pretty good at advocating. So pull that, just really embrace that part of being a nurse and advocate for people. Our words and actions are very, very powerful. And so really just listen to yourself too, like think back, and you can go back and you might reflect on something you said even a day before, and go back and talk to people about, as you thought about it, you wish you hadn't said it. So like for one thing, one of the doctors in one of the trainings we did recently, as we were asking, people to reflect on the training. And in this case, we do the 4-hour training now virtually, 2 days to a week apart in this particular state. And she's down in Georgia. We've actually published her story. She let us publish it. She's embarrassed a little bit by it, but she says if this would help other people. But what happened was she had a patient come in and talk about she had some bleeding and she was worried about her bleeding, and she was kind of dismissive to the patient. She was polite, but she was just like not thinking what a big deal. But the patient asked multiple times, is this really okay? It was first trimester bleeding, not a lot of bleeding. And she was just like, yeah, no, it's fine. But anyway, as she was sitting in the training, she realized she really hadn't heard the patient's concern. She wasn't really realizing how stressful this bleeding was for her, a person of color, and having heard the statistics nationally. And so she went back, and I give her a lot of credit. She actually called the women up the next day after the training and said, I'm just calling to make sure you're doing okay. I was thinking about you. And the patient's like, oh yeah, no, I haven't had any bleeding. Everything's okay. So she's like thinking, oh, well, all right. Well, I at least feel better that I reached out to her. Well, once you know it, a few days later, she gets this email. And when the doctor tells the story, she gets all choked up, and it's kind of, it's very touching. The patient said, so now I get all choked up. But anyway, the patient said to her in this email, thank you for calling me. I have never felt respected at any of my other visits, and you really listened to me. And, like how much that meant to her, that she took the time to write her an email. But even more, then a few days later, the same doctor had the experience of a woman who, a teenager, had coming in on her, she had seen her on her 7th entry into care, and then again on her 8th. And she kept coming in complaining of pain that woke her up at night. And she's like, we've got to do a full workup. She's been in, and that was between the trainings. And she's like, I realized I wasn't really listening to her. And when I said, let's do a full workup, something's going on. The residents actually said, well, she's homeless. She's 16. And they were thinking she was probably just seeking drugs. And she's like, she said, nope, we need to look deeper. And once you know it, she had a twisted ovary. She then had to have emergency surgery, and her ovary, thank heavens, was not lost. And the patient kept saying over and over in the operating room, thank you for listening to me. Thank you for listening to me. Nobody else was listening to me. So the words are very powerful. How we act is very powerful. Again, as was said, overcome our guilt. This isn't about we're not about trying to make anybody feel guilty. It's about self-awareness and about leading to change and coming up with action plans. So we spend a lot of time in the training, helping and supporting each other, thinking about what we can do differently, and action plan, and using and creating a speak up action plan. Everybody leaves with having crafted a speak up action plan. Again, speak up is a journey. It's not a sprint. We're not always going to get it right. So we've put together a whole pathway. The point is that you're trying as part of the acronym. So this pathway, this is the Speak Up pathway. This is on our website. So you can go back and look at this and look and see like what are the different steps. Steps 1, 2, and 3 are the Speak Up Champion opportunities that you have for free of charge here in Massachusetts because of the support of Fifi at the Department of Health, and then also your Mass AWHONN leaders who really wanted to really make a difference in the state and really wanted everyone to have the opportunity to attend this training. So, you know, this first step is about forming a committee, taking your implicit bias self-assessment. So and then we have some online modules, and you can start to, when you register for one of the educational sessions, then you will be sent a promo code so you can access the modules, the online modules free. And the first module, we would love to have you take that before you come in person. And then you come to the live training. And in that live training, it's 8 hours of training divided into 2 separate days. That, as I said, you would then create your action plan. And we also want you to sign the Speak Up Pledge. And you can feel free to go sign the Speak Up Pledge today too. And that's at perinatalqi.org. And then the third step is after the training is there's still work to be done. The training isn't what's going to make a difference here. It's what we do with the education. And so going on and reflecting, and I love Mimi's like call for a 21-day challenge for all of us here in AWHONN, Massachusetts. So yeah, I would love to be a part of that too. So count me in as well. And also completing the second 2 modules of the project, etc. We also then have other stages. Those that want to go on to become ambassadors for with Speak Up, that's like even a deeper dive into content. The first course is really to level the knowledge around some basic, dispelling basic myths, getting some action plans and all of that. And then those that have completed ambassador training would then can go on to apply to become faculty. And we would love, our goal is to have all of the perinatal clinicians, actually, we don't think small, we think very big, that all of the perinatal clinicians in the United States will complete stages 1, 2, and 3. And we're going to need a lot of faculty to make that happen. So you all can then, we'll provide you materials and you can run the programs at your own facilities eventually as we roll this out. The faculty will need to be paired up with a white person and then a person of color. That's the model we use. So you would need a partner because there's insights that both bring. And again, this can't just be on the shoulders of, this is not a problem that was created by Black people, and it's not their problem to solve alone. And this is, but we need each other. So, so the 8 hours of live virtual education, again, split between 2 days. Most of them are going to be a week apart, which I think gives you time to reflect in between. And the first day does a lot of foundational work, and then the second day is really focused on creating the QI action plan. You have to attend both sessions in order to get CNE. It's both, or it's all or none. So anyway, so just want to keep that in mind. These are the dates when we have training in 2021 available. The registration is open for January 20th and 27th. Then we'll, once that registration is filled, then we will start to release the registration link for the March dates and May 18th and 25th, and so on. If somebody, I asked prior to this, if somebody would be willing to post in chat what the link to register, so you all would have that. There's also a flyer that has all of the schedule of the agenda and everything, and has all of the details available to you. And again, this is with the generous support of the Department of Health in Massachusetts. This is my colleague Renee, who has helped create this entire program, and very excited to, we love working together. We worked together for many, many years in different roles. And so you'll get to meet her as one of the faculty for this program. This is the flyer. This is the front page of the flyer. And then there's the second page, which I'm not showing, includes the agenda and all the things that you would be taught, and then all of the information here on the back page. And there is a link here, and the URL is right here, but it might be nice to just have that put in chat for people. And space is limited. It's a sensitive conversation, and so it's via Zoom, via a virtual session. We had been doing them all in person, so it's a challenge to move. So we keep all of these sessions small, and try to keep them around 75 people. So if you end up not taking a spot, please don't take a spot if you're not sure you can come. We want to make sure that people who register are able to be there. And again, here's the modules that we have available for some of the pre and post work. We also then invite you to attend conference calls, and these are national. You'll be with Speak Up champions from all over the United States in these calls, and we are now, they've grown to the point, we have now about 400 people who've gone through this live training, and we now break people into breakout groups where you can hear insights and get ideas from others around the country, and we have 3 of these conference calls a year. And anyway, so it's, like I said, it's a journey, not a sprint, right? And then this is where you would go on the website. This is what it looks like. Once you get your promo code after you register for the event, then you'll be sent a promo code in your registration materials that allows you to download and access these modules. Each module takes about 30 minutes. They do have C&E as well that you will receive from them. Again, we want to encourage you to form a Speak Up Action Committee, complete your self-assessment, create, finalize, and implement your action plan. One of the also thing is reviewing policies and procedures and updating data systems, and to be able to include race, ethnicity. And it's from a QI perspective. So the whole point is is just looking at our data, digging in and figuring out, like, here's our team. We're going to mobilize, assess, plan, implement, track. Or if you use the model for improvement as like your QI process, then it would be, you would put together like your plan, do, study, act cycles. So thinking about all the ways in which we can start to uncover and learn and be able to become very effective anti-racist and eliminate disparities in perinatal care. It is possible. Years ago, there were disparities in immunizations. And what did that mean? That meant that children in poor communities and also children of color primarily had more childhood illnesses. Well, by changing systems and structures, immunizations became available. Then we were able as a country to eliminate disparities in childhood illnesses. We can eliminate, there is no physiologic reason for there to be disparities based on race, ethnicity. So a person with darker skin has no more propensity for having a hemorrhage than a person with white skin. With hypertension, we can also reduce all the cortisol levels and make life easier to help reduce. But the disparity that we can eliminate is if you had a white person and a Black person with the same hypertension, you still will, the Black person will have higher rates of morbidity and death than a white person with the exact same vital signs and same conditions. So that's the disparity. We can eliminate those disparities. And I'm confident that all of you can make that happen. In fact, I have a long-term goal for the Speak Up program that, and this may be too long, you may actually be able to do this faster than that, but at a minimum by 2035 that we will eliminate all perinatal disparities in your organizations and communities throughout the United States, that Speak Up Champions will be able to do that. And so this is historic, and I think I would be thrilled if we could do it in 5 years, not 15, but I know that it can be done. I've dug in, I know these data, and I know it's possible. So, and with ongoing action and QI processes, I think the state of Massachusetts, you all are very skilled QI, very knowledgeable in QI. I think it's gonna be exciting to see what we accomplish here together. So we can all win when we make sure that the people who have the worst outcomes currently have better outcomes. It helps everyone. So this isn't about leaving anybody behind. This is so everyone wins. It's not a scarcity issue, meaning it's not one group needs to be taken care of more than another group instead of another group. It's saying that everyone matters, and we need to dig deep to make sure nobody's left behind. And one way I think about it is, if we think about life, sometimes people think of life as zero-sum game. There's only so much to go around, but in this situation, the more we give, the more people who do well, the better the outcomes, the better it is for everyone, the better it is for all of our communities, for each one of us. So there's plenty to go around, and we just need to adjust so that we make sure everyone has the best outcomes possible, regardless of their race or ethnicity. And this quote is a very powerful quote. And Dr. Martin Luther King said, "In the end, we will remember not the words of our enemies, but the silence of our friends." So that gives me courage to speak up and to have created this program. And I'm so enthusiastic and excited to be launching this in Massachusetts with all of you and the AWHONN leaders. It's just, I'm just so privileged to be with you all tonight and to be a part of this historic time. So just remember that change happens with conversations, and crucial conversations can really bring about these changes. So if you have questions about the Speak Up program, registering for the events, just email us at info@perinatalqi.org. You can also go to the website. There's a contact form that you can submit. Feel free to reach out to us in that regard. And now, and just remember, QI does save lives. I've lived it, I've seen it, and you all know that too. So, so we will be saving lives together. And now I'm going to, hopefully you have some questions or comments that in the chat that you could put in. We're now going to have a Q&A session with everyone for see what questions or comments you might have. And I see there's some other Speak Up champions in the room here too, others that have completed the training, if they have things they wanted to add. Let's see, Kate and Colette are going to kind of help with this discussion.
So there's a lot of interest in the program, and we're trying to post the links. So there was a little confusion because I posted the wrong link. I posted the one for tonight, so ignore that one. But the January link is now up there, so people can register for that.
Yeah. So and one clarification is that we should make it clear that although this was because of the request of the AWHONN leaders, it's primarily for AWHONN leaders, but I believe that anybody on the perinatal team is invited to register. Is that correct?
Yes, that's what we're hoping, because we it takes everybody, really. This is for everybody. So.
And I've also posted the PowerPoint because people were asking about that.
Okay, great.
Deborah, I want to say to for anybody to reach out to your colleagues, your coworkers, tell them about tonight, tell them about the training. It really, it is our step to really learn and to speak up and try to make a difference. We've been doing this work and we care about mothers and babies and families, and it's time to do something about it. And I think that this training is something everybody wants to know. What can I do? This is clearly something that we can do and do it together. We can be kind to one another and do it all together.
Well said.
And you can unmute yourself and ask the question or give a comment if you have. We're so quiet.
We answered all your questions, or now you're too afraid to speak up? No. So,
I might ask Deborah if you'd like to explain when many of us did the training in person, and there's a lot of value to that. But I know that you have adapted it to be virtual, and you've done it in a couple of other states, and it has worked. Would you like to describe and how that works a little bit more?
yeah, well, the big thing that makes the biggest difference is, well, you know, virtual is just how we have to live right now, right? So we didn't want to hold up the training and say we could, and we're not going to let COVID stop us, right? So that's why we split it into the 4 hours, because I think it's too much to be on Zoom for like 8 hours. I think that would just be, and for such a heavy content. What people really liked was having that space in between, even if it's the next day, but I think a week in between, it just gives them some time to breathe in and out, and to really sit with the content and even go back and have some patient experience and actually hear what was happening at the desk. Like, I think after tonight, a lot of people might start hearing things in there that they say, or that they hear other people say, that they're like, whoa, what did I just say? What did I just do? And so that was really powerful for the Georgia team. One person was all excited and was like, oh, I'm all gung-ho. And she goes and she talks to people about helping her on her speak up plan, and she didn't get anybody wanting to help her. And so she could come back and say to people like, I'm feeling pretty like this is, maybe this is going to be harder than I thought. And so the group rallied around her, so I said, we'll help you, we'll be there for you. Yeah, so, and then I think we do like people to speak out into the camera and try to stay on camera as much as possible. So really make sure you don't think of this as the kind of training where you kind of just part there. You do need to really come in with your heart and your mind and be open, just like you would in person. And so we've also asked around, we have some community rules that the same as in person, but we added a couple around chat, like not interrupting people by chatting during some of the presentations, and then having time when people could actually share their thoughts. So yeah, it's different. It's not, we don't get to hug each other or really like but people have been very vulnerable and have really shared very personal feelings, and have honored us with their stories of being vulnerable. So it's very powerful, even virtually. And there are some benefits to the virtual, because that you get that space in between.
I have one more question.
Oh,
and this time it's for Fifi. So I am an optimist, but I'm also driven by outcomes. When will you come back and tell us all the good work that we've done? and we've made change in those graphs that you showed us.
I hope we will be on target for the Surgeon General's timeline. I don't know if you know, today was the day he released his call to action for maternal health, and there was a webinar, and he is really targeting reducing maternal mortality in the US from 17 by 50%. They're trying to decrease it by 50% in 5 years, in the next 5 years. So we can do that. We can think about 2025 as the target for the statewide improvement, population level improvement. But remember, all of that is driven by what you do at your institutions. You have to do it at the local level, and there is a way to quickly measure that through our implementation of AIM. So hospitals that are implementing AIM, we have 22 hospitals with wave 1, and then Kelly, correct me if I'm wrong, we have 9 or 10 more. So hopefully as you implement AIM in your hospitals, those numbers will start to go down at the institution level, and then that would be reflected at the population level when I come back to check, because I do want people to win the job award every year. Somebody has to go and get that award. So be ready. We'll be coming and looking at, what you're doing. I do believe in the power of nursing. I know you're at the front line. You have more power than the doctors. You create the culture. So if you can change that culture in your institution, you will make a great difference. That is something I firmly believe in as I embark into this journey with all of you.
Fifi, can I ask a question about the near miss? The data that you have for the near miss, do you have specific data for each one of them? Each one of the disease and the 21 item for Massachusetts?
Yeah, we have the numbers for each of the 21 conditions, which will be part of AIM. Mm-hmm. As we share the data with different hospitals for the AIM project. We usually give them the overall, but we also break it down by the different conditions. I didn't do that because I only had 15 minutes. I didn't want to bore you with a lot of data. But one thing that is important in everything I presented is the fact that pregnancy-associated mortality is going up for white women to a point that it's getting higher than Black women. And that is because of mortality due to opioid use. People have to keep that in mind. It's not pregnancy related. It is due to opioid, because they're using opioid more is why they die more. But in terms of the medical conditions like hypertension, hemorrhage, which is where the SMM is, we still have Black women with higher rates, and you can see that in the graphs. I really want to bring your attention to the fact that the difference is so big. The line for Black is so high compared to the rest. It almost seems like they're receiving care in a different country, in a different environment. When they all live in Massachusetts and they're seen by all of you nurses and all our doctors in the same facilities, why would we see huge differences between groups? The differences between Asian, Hispanic, and white are around the same. It's more or less, they're all clustered around the same level, which is what you would expect. When there is equity, everybody will be around the same level. When you have a rate, everybody will be kind of hovering around that same line, not seeing big jumps and big differences, which when you see those big differences, there is something going on, which is not just, medical care, it's beyond medical care. And that's where we talk about, the systemic racism, at the institutional levels.
Thank you. And to that point, there was a comment. It said someone sent me a private comment asking me about making sure we also recruit people of color to become nurses and doctors in the state, and also looking at, I would add to that also about hiring practices, like really making making sure that the environments are very embrace and supportive of people of color joining our teams and being part of your teams. I mean, those are really definitely ways in which we start to make a difference. And I think that was a very important comment. The person that made the comment, if you wanted to add to that, I'm not sure if I did it justice, so feel free to unmute and add to that if you would like to.
Thank you, Deborah. This is Laura Sternberger from Moms Do Care. And like you, we've been looking really carefully at our data and also speaking to families and to our staff about what really increases engagement and what helps our patients and participants to feel heard. And part of what people are saying is that it really helps to be supported by people who look like us, who understand our culture and understand our experience. And that's both from a peer mentor perspective of people who have been in recovery from opioid use disorders, but also people of color. So that's what prompted that question about recruitment.
Yeah, no, that's a really good point. It also brings up to mind, like I was in Indiana, this was a couple of years ago, and there was a nurse there who was a white woman in a hospital that primarily, a white nurse in the hospital was primarily people of color she was taking care of, and she just knew that she wasn't connecting with people, that there wasn't a lot of trust, that people are rapport. And so she started looking at what she could do, because we can't change the color of our skin, right? But what she did is she decided rather than standing above the patient, she sat down, and rather than talking really fast and throwing a lot at them, she slowed down, and she made a point of sitting down, introducing herself, and making sure that that she was connecting, but not in a power situation like standing over someone, but actually just more human to human, caring. But we definitely need to work to recruit people. I bet Colette would be all over that too. Like, right, and all of where's Kate? She teaches or was it Karen? No, it was Karen. Any of you who are also professors, reaching out to, and ensuring that we have more nurses of color, more physicians of color, teachers of color, so that we start to dispel a lot of the myths. And we also have, patients are cared for by people who are more like them as well. So thank you, Laura, for bringing that up. And I saw Audra made a comment. I'm so thrilled to have Audra here. She helped support the launch of this. You all know Audra. You want to say anything, Audra?
I want to say hello to everyone. I miss everybody in Massachusetts, and I'm so happy that folks have taken their time to be on this call. This is such an important endeavor, and definitely not one that comes with ease, because it's not what we do every day, but it's one that's extremely important, and something that I am, for one, extremely thrilled that we're going to have some tools and conversations and just the collaborative effort to really move this work forward in Massachusetts. And if there's any place that this can get done and done really well, it's in Massachusetts, and so I'm excited about that.
Great, thank you. And Lisa asked if there was, Fifi, she wanted to know about
my response. You can email me, and someone from DPH will help you with the roadmap. We have a number of staff who are trained in giving that presentation, sometimes in 2 people at a time. So just let me know if you want someone to come to your hospital at one of your programs or whenever you want, and we can walk you through how you can use it as a tool at your institution. I want to go back to the fact that people do want to have providers that look like them. And of course, like you said, Deborah, it starts with allowing them to access medical schools, which currently is not happening. Acceptance rate at Harvard has been the same since the 1950s in terms of how many Black people they admit. So that has to change. But a bigger conversation I always had with Audra is, honestly, it doesn't matter what type of provider you are. I should be able to walk in any hospital and feel confident that I can receive the best care from anybody, regardless of their color. That's what equity is. It seems like we're not being as rigorous as we should be, because it shouldn't matter if the provider is of color or a different color. They should give you the best care possible. And that's what we should be aiming for. That's what eliminating inequities means. Not to trying to find a way, okay, we'll give you a provider who looks like you. What about if I don't want a provider who looks like me? What I want is care, good care that is a reflection of my needs, because at the end of the day, it's really meeting people's needs wherever they are, because needs may be different. It's not the standard of care. It's not the bundles. The bundles are standard of care, period. That's not enough. In addition to standard of care, we really need to, address specific personal individual needs has to be addressed. That's what equity is about.
That's really, thank you for clarifying that and correcting that. So I appreciate you stating that. There was also a private comment to me saying, and if you want to speak, say this yourself too, that's okay. She says she's the only Black nurse on her floor. And then she feels like everybody looks to her to ensure equity for Black patients, and that's not fair. This isn't we do need to have more people of color in doctors who are doctors and nurses, but we don't wait for that. This isn't about looking to them to ensure equity. So right on. Thank you, both of you, for correcting that. And I don't know if the person that wrote that comment wants to say anything more or not.
I entirely agree. Thank you. Thank you for you both for saying that equity is up to all of us. And I think that I didn't mean to imply otherwise. I think that part of what we've heard from our own patients is how helpful it is to be working with somebody who understands them. But I think to your point, that it's important for all of us to enter into the relationship of supporting patients with humility and the perspective that equity is important regardless of what we look like or what they look like. So I completely agree, and thank you for pointing that out.
Yeah, thanks. See, we've already had a nice deep discussion tonight to help us all understand better.
Yeah, so there's a lot of interest in the roadmap. Is there the address that's on the roadmap is respite@state.mass.us. Is that where people can go to get the data? They're asking Fifi.
Yeah, actually, you should just email me and I will put you in touch with somebody. I think whatever is on the slide is outdated. We will post the roadmap on our website at some point. But if you really want someone to come and talk about all the steps, because you could be at any of the steps, you may be at the beginning or in the middle, somewhere in the middle, but someone can come and walk you through how you use it as a tool. It's really a tool. It's meant for everybody to use. We would appreciate if people can take it and pilot it and implement it. We've piloted it in our home visiting programs, but you can do it at the hospital level too.
Yeah, Fifi, do you mind putting your email address in the chat?
Oh, sure. It was on the slide, but I'll put it here for you.
The other thing I think people need to understand with the whole maternal morbidity is the fact that there's many things that contributed, and the addressing the implicit and explicit bias is one of them. We need to be able to promote a more cultural diversity, like people say. We need to be able to engage all the stakeholders in understanding that there is a problem and that they need to deal with it. You know, we need to make sure that the standard of care on labor and delivery and postpartum units are, you know, are equal, and that we also need to understand the individual needs of our patients, so that we can address what the problem is with them. And then there's the whole issue of disparities that is such a big piece of it, and then the policy issues. So it's not one individual things that are causing this 3 to 4 times higher in death in Black women, and it is across you know, education, it's across the socioeconomic standards of these patients. So I think it is something as nurses that, and as we're talking about it, you know, we need to be able to take a look at it in different lens. And then one of the lens that we're talking about is trying to make sure we understand how we can speak up and help our patient, because the communication piece is an extremely big piece of it. When they don't feel heard, when they feel that they are at the hospital, but it's like they're not present. So how can we connect? Because then, and then not assume, like you said with this woman who had, you know, the pain, and that they just don't think it is, you know, they think it's something else, or she's seeking medication or something, and not really paying a hearing exactly, I'm having pain, there's a problem. So I think these are the things, I think part of the listening to our patients and trying to make sure that we are able to give them, you know, the care they deserve so that they don't die.
Right. Nothing needs to be said beyond that. And I do, I mean, unless Fifi, you have something you want to end with.
I just wanted to end with one thing. Colette is so right. Medical care is only 20% of our health and well-being. 80% of it comes out of the medical community. But when it comes to SMM, it is the responsibility of the medical providers to save women when they're in the hospital. At that point in time, it is the medical care that can save them. And until you save them, you can't send them back to deal with the social determinants of health in the community. If you let them die, you lose that opportunity to address the rest of the social determinants of health. So we have to think about that. 1 minute, you know, delayed care can kill women, and we really need to save them first, and then think about how we can connect them with programs that are available in the community. And, you know, we all should be working together. So I agree with Colette.
Thank you so much. I think we now turn it over to Nicole to close us out. And this has been, I'm very excited for more conversations.
This has been just absolutely amazing. And through my work with AWHONN, I've learned little bits. I've learned about weathering from Colette. I had no idea what that was. Karen touched upon it with her speaking today. And I am so excited about all the comments that we have in our chat. And I just want to welcome all of you to share what you learned today or what was reinforced to you today. And you're here because you want to help make a difference. So please share this program with anyone you know. It's being offered to you free because it is so important that this message and these lessons get learned. And the links have been put into the chat. If you were on today, we will follow up with an email to make sure that everyone has access to the link for the January program, and then get you on mailings for future programs if that date doesn't work for you. So thank you to everyone who spoke and shared personal stories. You know, some of us have never experienced the things you've experienced, so thank you for that and your honesty. And I wish everyone a good day. Like Mimi has said, be kind to each other. Thanks, everybody.